Hi, my name is Christine Barthen, and I'm currently a PGY1 community-based pharmacy resident at Wake Forest Baptist Health in Winston-Salem, North Carolina. Today I will be presenting on my research, Impact of Implementation of a Triage Pharmacist Role on Clinical Intervention Activities in a Specialty Pharmacy Call Center. The Wake Forest Baptist Health Specialty Pharmacy was established in 2015 and is currently dual accredited. My team and I have nothing to disclose at this time. Following this presentation, I would like the audience to be able to describe the impact of a triage pharmacist role on clinical intervention activities in a specialty pharmacy call center. In order to respond to an influx of specialty pharmacy patients since its development, a dedicated specialty pharmacy call center was established at Wake Forest Baptist Health in 2018. A triage pharmacist role was implemented in 2019 to help improve timely resolution of patient clinical interventions. Of note, this was FTE neutral. A new position was not created to support this effort. Prior to delineation of this role, call center pharmacists shared overlapping responsibilities to resolve patient clinical interventions. The following escalation protocol is utilized by specialty pharmacy technicians in the call center. When a patient care activity requires escalation to a pharmacist, the technician opens a clinical intervention patient activity in Triage STM, a specialty patient management platform. Examples of pharmacist-driven clinical intervention activities include situations such as drug interaction and side effect questions, drug therapy changes, and non-adherence. For urgent matters, the call is warm transferred to the triage pharmacist. For non-urgent matters, the triage pharmacist addresses activities in the clinical intervention patient queue. Prior studies show the use of triage services to better serve patients. In one study, a nurse-led telephonic triage service was used to improve patient access. In a study in the pharmacy realm, a centralized call flow protocol directed pharmacy-related calls to the appropriate areas. There is a gap in the literature assessing delineation of roles specifically within a specialty pharmacy call center. The purpose of this study was to assess the impact of a triage pharmacist role on clinical intervention activities within a specialty pharmacy call center. This study was a single-center, IRB-approved, retrospective chart review of all clinical interventions completed in the specialty pharmacy call center 1 year before and 1 year after implementation of the triage pharmacist role. There was a washout period to account for clinical interventions that were in progress. A clinical intervention activity is defined as a situation identified by a pharmacy staff member that requires pharmacist review and is denoted as clinical intervention patient within Triage. Interventions involving oral oncology agents were excluded, as these interventions are addressed by separate dedicated oncology pharmacists. Interventions deleted for administrative purposes were also excluded from this study. The primary endpoint of this study was time to completion of clinical intervention activities. Secondary endpoints included time to first outreach attempt, whether this be to the prescriber or to the patient, time to intervention completion for therapeutic categories such as rheumatoid arthritis or transplant, clinical intervention categories such as drug therapy appropriateness or drug safety, and clinical outcome categories such as potentially improved therapy adherence or prevented premature discontinuation. Patient care plans or follow-up plans created, patients discontinued from specialty pharmacy services, and clinical interventions accepted. The data points listed were collected using two different reporting systems within Triage. Descriptive statistics were used. Additionally, chi-squared was used to analyze nominal data, and t-test and ANOVA were used to analyze continuous data. There were a total of 1,521 clinical intervention activities included in this study. Outcomes were realized concurrent with a notable increase in clinical intervention volume between the pre- and post-triage group. This difference can be attributed to increased specialty patient volumes. Taking a look at the primary endpoint, time to clinical intervention completion, there was a significant decrease in average time to clinical intervention completion. The average time to clinical intervention completion decreased by 1.1 days. time to first outreach attempt decreased by 0.68 days. A decrease in first outreach attempt most likely led to a quicker time to intervention completion. Additionally, if the first outreach occurred at the beginning of the day compared to later in the day, resolution of the clinical intervention by the end of the day was more likely. This graph shows that the number of clinical interventions accepted remains similar in both the pre- and post-triage groups. It also demonstrates the difference in number of clinical interventions between the two groups. There was a significant effect on time to clinical intervention completion among therapeutic categories, clinical intervention categories, and clinical outcome categories. The number of patient care plans remained similar between the pre- and post-triage groups. Patients discontinued from specialty pharmacy services increased in the post-triage group. As previously discussed, a limitation of this study was the difference in sample sizes between the pre- and post-triage group. In conclusion, the implementation of the pharmacist triage role led to faster resolution of clinical intervention activities. This was the primary endpoint of the study. Related to time to clinical intervention completion, the triage role led to quicker first outreach attempt to resolve the intervention. The implementation of the triage pharmacist role was a proactive step to more efficiently serve increasing patient populations. This study showed that there were collective differences between time to clinical intervention completion in therapeutic categories, clinical intervention categories, and clinical outcome categories. Future opportunities exist to further evaluate differences within these groups. In conclusion, delineation of pharmacist roles within a specialty pharmacy call center supports a more efficient workflow for triaging and resolving clinical patient concerns. The following is a self-assessment question for my presentation. What is one way the triage pharmacist role impacted patient care? A, led to slower resolution of clinical interventions. B, led to a quicker first outreach attempt. C, led to higher acceptance of clinical interventions. Or D, led to a significant increase in patient care plans created. The correct answer is B. It led to a quicker first outreach attempt. This was one of the secondary endpoints evaluated by the study. I would like to thank the rest of my research team for helping me with my research project. Thank you for taking the time to learn about my research project.